Hello everyone, welcome to today's webinar. And so as the title of which is, you can see what seems to be the problem. So as the title and the picture suggest, we're going to discuss some rather typical health problems today. All right, but to be more precise, I'd like us first to have a look at some health myths. By the way, do you know the word myths? Do you know what these are? Oh, so some people say yes, some people say no. So that would be, we'll put it to quite a similar word to a Polish word, some ideas a lot of people believe in, but which actually are not true. Okay, so you'll see in a minute what I mean. And then we'll, right after that, we'll revise body parts and some vital body organs. Okay, and having done that, we'll analyze some symptoms and most common illnesses that you can suffer from. Next, we'll see the most frequent questions asked by doctors and see what advice, what suggestions you can expect to hear from them. And after that, we'll go on to talk about some, well, not something nice actually, because it's accidents and injuries. And right after that, we'll have a look at some hospital treatment. So the kind of treatment, the kind of help you can receive in a hospital. And last but not least, I'd like you to have a look at or actually do a quiz. So a bit of a surprise, perhaps. A quiz which will tell you how old your body is. So I hope you'll enjoy it. Right, so let's get started. Have a look at that statement. Antibiotics can cure a cold. Is it true? By the way, what's a cold? Do you know the word cold? All right. So somebody's saying it's somebody's saying it's the problem with the nose, let's say, but some people are saying it's a slight illness, right? Slight illness that makes it difficult to breathe through your nose, makes your throat hurt. Yes, I see a lot of people know the word. So what do you think? Is it true? Can antibiotics cure a cold? Lots of people say no, and it's actually a good answer, because despite huge medical advances or progress that's been made over the last century, the common cold is still incurable. So it's impossible to cure or make it disappear. And medicine does little for symptoms either. Antibiotics won't help, as your cold is caused by one of over 200 viruses. Imagine that. So the only time you may actually need antibiotics is when you develop a throat or ear infection. So in this case, I mean, the case of the common cold, you can simply, well, go to bed, drink a lot of fluids, and wait till you get better. So do you agree? Oh, right, so Grzegorz is saying it lasts 7 days usually. Yeah. Well, do you agree with that? Let me see your answers and pray, Bogdan. Exactly, you can pray that you get better. Thank you. Lovely answer. Okay, right, let's have a look at another myth. Eating chocolate can cause acne. So if you don't know the word acne, I've added a picture for you. What do you think? Is it true? What do you think? That's a tricky one. Somebody, okay, so you say yes, some people say no. Well, let's have a look at at what some experts say. Acne is a condition that causes the skin to produce too much oil. However, research has failed to find any connection between eating fatty foods and acne, although obviously too much fat in your diet might be bad in other ways for you. So believe it or not, but washing too much, rubbing the skin too hard can make the condition worse. You know the word rubbing? What's rubbing? Like if you press it sort of too hard. So what you should do, or it's best to wash it, your face gently, delicately, twice a day, and not rub it too hard, not press it too, yeah. Bogdan is translating the word. So what do you think of that one? Would you agree? Have you perhaps changed your mind? Because some people said yes at the beginning. Okay. Oh, you're not so certain. Okay, let's have a look at another one. So you can catch a cold, so become ill if you go out with wet hair, or if you just wear a t-shirt, say in winter. What do you think? Is it true? Racist. So lots of people say yes, true, but some people say no. Okay, so let's have a look at what experts say. Well, of course, it's difficult to ignore your mother when she tells you to wrap up warm, put some warm clothes on, or dry your hair, or you'll catch a cold. But in fact, colds are not caused by the cold, by low temperatures outside. They are caused by viruses. So walking around with wet hair or a t-shirt in winter, well, will obviously look silly and will make you feel cold, but you'll only get a cold if you come into contact with an infected person, a person who's ill. So actually the best way to avoid, not to catch viruses is to, well, wash your hands regularly when there's some bug or virus going around, in the air. Would you agree now? Yes, Grzegorz would pray again. That's really funny. So yeah, you don't really have an opinion here. Okay, so much about health myths then. And okay, but what if you actually have caught a cold and you have some other medical problem, and you need to see the doctor? Well, it's probably wise to remember. Well, if you are in an English-speaking country, it's probably wise to remember the basic body parts and body organs. Okay, so what are they? Starting from the left, what is the green arrow pointing to? Yeah, if the body is weak, you can catch a cold as well. Right, is it, well, yeah, actually most people are saying it's a head, which it is. The next one, right below it, what do you think it is? Bogdan's right. Oh, right, not only Bogdan, but also Eva. So it's a shoulder, well, there are two of them, so shoulders. Yeah, so it's like in below neck, right? Some people say it's a neck, but it's in between head and shoulders. What then, below? Please notice that the arrow is pointing to the very middle of the arm. What's there? Perfect answers. Alina, Tomasz, thank you. It is an elbow, right? So the kind of joint where your arm bends. And then below, and again, it's not as simple as the hand. The next arrow, right, Monica, very good answer. And Vitold, yes, it is a wrist. So the joint between your hand and the lower part of your arm. And right below the upper part of your leg, what's this one? Yes, just careful with this. Yeah, the spelling is tricky, as I can see. It's not necessarily correct, but that's sort of what you mean. It is a thigh. Yeah, notice the spelling; it's a bit different. What about the lower part of your leg? Do you know this one? Oh, this one seems more difficult, so I can't see any answers. This one is a calf. Okay, so a calf, and the next arrow right below. I'm wondering if you know what this is pointing to. It starts with F, yeah, but it's not the joint, okay? It's actually the body part we use for walking, yeah. So I hope it helps a little. Yes, it is a foot, and hopefully remember the plural of foot is feet. Now the next arrow, yeah, thank you, Bogdan, toes. So remember, you have fingers on your hands, but toes on your feet. Let's go, actually, let's look at the center of the body now. What's the arrow pointing to? Sort of the center part of your body. Oh, right, Okay, so 3 different answers, but it's actually supposed to be chest. Yeah, so somebody's saying lungs, but Yannick, not yet, because that's like a body organ. So we have a chest, and right below it, oh no, it's not hips yet, but right below. Okay, great answers, but yes. So okay, somebody is saying stomach, but it's more like a body organ. Yeah, the body part is an abdomen, or more maybe more often uses belly simply. Yeah. So it's sort of the middle part of your body. And now the arrows on the right. What is this one pointing to? You've already sort of told me before. Yeah, of course, it's a neck. And then behind your body, there is, yeah, obviously. Well, it's actually pointing to your back. Some people say an arm because, yeah, there's an arm. What about the next arrow? What is it pointing to? I think somebody mentioned it before. Pocket. Yes, it could be a pocket. It's just that it's not a body part. Somebody's saying a hip. Perfect. So a hip. So it's like between your waist and your upper legs. Right, what's next? Sort of something you sit on? Boom, thank you, Grzegorz. Right, we have some of the expressions here which perhaps I shouldn't say, but a bottom it is, yes. Okay, somebody's saying a knee, which is the next part of the body. And right at the bottom, what do we have? Yeah, somebody's saying buttock, of course. Yeah, careful with this spelling here. This one's an ankle. Ankle, do we all know the word ankle? What's this? That would be the kind of, yeah, of course, it's the joint between your foot and your leg, which often sort of causes problems, right, if you fall. Now, by the way, what is the difference between the two words? You can see pictures of what in here on the left. There is an this one is an ankle, obviously, yes, and on the right, what I would like you to come up with here, Bogdan, thank you, is an uncle. So careful, some of my students often have a problem with the pronunciation of the two words. So the body part is an ankle, and your relative is uncle, right? Hope you see the difference. Ankle, uncle. You can repeat, actually. Okay, now what about the most basic body organs now? All right, so let's start with the one on the right. Have a look at the green arrow on the right. What is it pointing to? It's like the vital organ of the body. Careful with the spelling again. This one is the heart, of course. Now look to the left, please, sort of on the same level as the heart arrow. There are two of them. Thank you, Arkadiusz. It is a lung, and of course there are two lungs. Okay, right below the lung. What's below the lung? Liver. Thank you. Of course, that's what it is. So the organ which cleans your blood. And then on the right, let's move to the right. Stomach. Just careful with the spelling again. Right. So the spelling is a bit different, Eva. And then again on the left, what we're looking. Oh, okay. Somebody's saying intestines, but it's sort of right below. Look at the arrow below liver. What is it pointing to? I'm not sure if you can see it clearly. Arkadiusz, thank you. That's what it is. It's a kidney. Do we know what it is? Kidney. Do you know the word? So they, what do kidneys do? So it's one of the two organs which separate waste liquid from our blood. Well, and they make urine. So you kind of filters, okay? Yeah, I see you know. So yeah, so they, I see now the word kidney, two of them, looking like beans, sort of, which we'll see in a minute. And right below on the right, what do we see? Somebody's mentioned the word before. We have small and large intestine. Okay, so what happens here? It's the tubes that take food from your stomach, well, out of the body, right, out of the body. And at the very bottom, maybe I'll help you with this, but somebody, yeah, Arkadiusz, thank you so much. It is a bladder, which, if you'd like to use Polish, is, so it's like a bag that contains urine. Does anybody know? Would you like to use Polish for this one? Oh, what a nice word somebody used for intestines, piping, because these are some kind of pipes. Oh, right, Janek, Arkadiusz, and Tomasz, perfect answers. So bladders for collecting your urine. That's what it is. All right, so let's see how much you've remembered. What do you sit on? Do you remember? What do you sit on? Bottom, thank you. That's what it is. You shrug them when you don't know the answer, so you kind of raise and lower them to show you do not know the answer to a question. Shoulders, thank you. Women like to have them slim. Hips, okay. Anything else? Angles, interesting. Okay. Well, I'm not sure about that one actually, but well, what I meant here is thighs. Okay, waist, of course, as well. It's often mispronounced as uncle, but it's not an uncle. It's a body part. Ankle. Thank you. You wear your watch around it. Wrist. Thank you very much. Okay, there's more. There are two of them, and they look like beans, which you can see here in the picture. What are they? So it's yeah, of course, it's kidneys. Yeah. So we have some body organs in here. We use them to breathe. What do we use to breathe? Thank you. Great answers. Lungs. The organ that collects urine from kidneys. What's that? Thank you. All good answers. Bladder. And it can hurt when you've eaten too much. What is this? Stomach. Perfect. Thank you. So you remember everything correctly. Okay, so now when we know all the body parts and body organs, we're ready to make an appointment with a doctor and tell him or her, well, what our problems, what our symptoms are. So what about these symptoms? What can happen to us? So we can, for example, feel dizzy or weak. I'm sure you know the word weak. What about dizzy? Do we know dizzy? What's this? Can you please use the question box to answer? So that's like you're kind of unable to balance, right? Because you feel ill. Okay, like when you're dancing in circles. Yes, your head's spinning. Very good. Okay. Well, something can hurt you, like a body part, or be painful, of course. You can, of course, feel pain in a part of the body, like in your back, in the chest. Or you can have stomachache, toothache, headache, backache, earache, to name just a few of them. Please notice the difference, the two words pain and ache, which are synonymous, but are used differently, right? So you can feel pain in a body part, but you have stomachache. So you add ache, the word ache, to a body part. Ache can also be used as a verb. So you can, for example, say, the noise makes my head ache. Okay, it aches me, means sort of hurts me. Okay, and some more symptoms now. What do you think the picture represents? What's this problem here? Anyone? What problem do we have here? Right, thank you for some good answers, Alina. All right, so we see high temperature or fever, right? So that will be very high temperature. Next picture, I hope it's clear enough for you. What does it show? Pain in the neck, okay, could be. It's funny, Gregor. Okay, or it could be a cough, right? So we can use it as a verb to cough, or we can have a bad, nasty cough. She can see it. So the person is actually, the girl is coughing and covering her mouth so as not to, you know, get anybody infected. So it's actually a wise thing to do. Okay, what about this picture? Somebody's, yeah, kind of sneezing, catarrh, okay. But also there's another way of saying here, and I'm sure you know it because I remember, oh, perfect, Monica and Machi. Yes, the person has a runny nose or simply has a cold. Okay. What about hay fever? Do you know this one? What's, oh, okay, some kind of, right, reaction to, right, some allergic reaction. So that's more like it's a medical some kind of condition caused by pollen, so kind of dust from plants, right? Would anybody like to use Polish here? What's hay fever in Polish? So think of allergy, pollen, you know, the dust in, okay, yeah. So I see most of you actually know this expression. Okay, and let's, okay, thank you. Let's go on to more symptoms. What's happening here in this picture? What is this person doing? What's happening with this person? What do you think? Deadline is coming. Oh, perfect. Yeah, that's how you feel before a deadline. Oh, Alina, thank you. The person is shivering. Okay. Yeah, the person is shivering, or there's one more, to be or feel shivery. Yeah, especially like when you kind of feel cold, right? Especially when you have a cold, or when you have some other serious disease, you might be shivering. Yeah, or you might be freezing. That's right. Okay, more symptoms. What about this picture? Maybe not the best of pictures, but I hope it gives you an idea of what it is. What problem do we have in here? Anyone? I'm sure you know this one. Yawn. Okay. It's funny. Yeah. Okay. So it's okay. Alina's right here. So it is a sore throat, some kind of inflammation. Thank you. All right. Okay, another problem, which I have a picture of this one, is an upset stomach. Might be connected with some food poisoning, right? Like if when you've eaten some food which is not fresh, right? Well, sometimes it might lead to, do you know what this picture sort of is symbol of? What problem might we have? Like you keep going to the toilet. Adam and Eve. Peeing, okay, but it might be more serious than peeing. What do you think? Yeah, so the spelling is kind of tricky here. Let me help you. Might be diarrhea. Okay, so you keep going to the toilet. Oi. Okay, I see some expression which is perhaps not an expression I can use here. So diarrhea. And last but not least in here, we might come out in a, do you know this one? So red spots on your skin. Again, might be caused by some, yeah, might be a bite, but it might also be like, red spots on your skin, like caused by some allergy, or like when you're, allergic to some food, you've eaten strawberries, but you're allergic to strawberries and you come out in a, no, nobody knows? It's a rash, okay? So remember, red spots on your skin, okay? That's what you might come out in. Okay, so let's practice. What about the first one? I've got tooth. Remember? Right, lots of good answers. It's actually not pain. You can't really say tooth pain, but toothache. I can't stand the, what's the next one? I can't stand the pain, thank you. Right, number 2. I have to cancel my class today. I can't speak. I have a, perfect answers. Great, everybody is right here. Sore throat. Number 3. Ouch, my back. I can't move. Perfect and perfect grammar. Thank you. My back hurts. Somebody says aches. Yeah, but so I have a pain in my back, but it hurts. Yeah, you would rather say. Number 4. I've got an ear. It's so earache, obviously, and it's so. Oh gosh, it hurts so much. Yes, thank you, Tomasz and Alina and other people. Careful with the spelling, just one L. It's so painful. It's so painful. Okay, so having described symptoms to the doctor might give you a diagnosis saying what kind of illness we're suffering from. So right, so he might or she might say it looks like just a common cold, which I hope you know. It's like a cold, right? Common cold. You can obviously use the questions box to say what it is. Yeah, it's a kind of slight, slight illness. So your throat hurts, it's difficult to breathe normally. Upset stomach, maybe sometimes. Right, so it's just one of the most popular kind of illnesses. Very, very, not a serious one. And then we might suffer from flu or influenza. So it's well, if you're not so lucky, you could suffer from this infectious disease, which is like a bad cold, but it's more serious. Okay, so would you like to use Polish for this one in the question box? What's influenza? Of course, Bogdan, very good. Right. Now, if you go down with this disease, you have a serious problem with the lungs, okay? So it's difficult for you to breathe. So it's pneumonia. Would you like to use Polish for this one? What's pneumonia in Polish? Oh, right. Okay, good answers. That's what it is. Yep, precisely. So this kind of inflammation of your lungs, yeah? Okay, now another one, bronchitis. So it affects your bronchial tubes, makes you cough. Okay, so the kind of the small tubes that take air into your lungs. Would you know what this one is? Or do you need some help here? Bronchitis. Oh, well, actually, you know what I see. Okay, very good, Monica and Jacek, very good answer. Very good. Okay, and last but not least, well, if you happen to have tonsillitis, you have a serious infection of the tonsils. Tonsils, do we know? The two small round pieces of flesh at the side of the throat, near the back of the tongue. Yeah, right, I see you know the word. Would you like to use Polish for tonsillitis? What kind of disease is it? Well, okay. It's actually angina. Sorry, excuse my, sorry that I've used Polish, but it actually is angina. Yep. All right. All right. So some difficult names to remember. So let's perhaps have a look at a very quick exercise. Okay. Oh, so the doctor is checking you up and saying, or is examining you. Nothing to worry about. It's just that, yeah, just a common cold. Yeah, or cold. Now you have a serious infection of the tonsils. So it is, do you remember? It's very similar actually to tonsillitis. That's right. And one more, you have a fever, you're coughing, and you have a hard time breathing. So it sounds like, what to me? Okay, could be flu, could be, okay. So it could be actually, well, what I meant here is pneumonia, but maybe, yeah, maybe it could be, somebody says bronchitis as well, or even, or flu, Yeah, it could actually happen with these diseases as well. Right. So, but obviously before a doctor gives you or reaches a diagnosis, he or she might ask you lots of other questions. So let's have a look at the questions a doctor might ask you now. So you might hear a question like, when did it start? Or how long have you been like this? Okay. Or, well, have you taken or tried taking any medicine? You usually do, right, before you actually visit the doctor. Are you on any sort of medication, like permanently, right? Because maybe you're suffering from some incurable disease, so you do take some medication. Are you allergic to anything? Right? Sometimes it happens that we are. And can you point exactly to where it hurts, or point to a body part? Or have you ever had any adverse reactions to any painkillers? Well, I assume you know the word painkillers. We do, right? So that would be the kind of, what's that? Tell me, please tell me that you know. Painkillers, right? The kind of pills that sort of, yeah, kill your pain or stop it or relieve, give you relief from pain, exactly. And adverse reactions, what do you think that is? Adverse reaction. Oh, perfect translation. Yeah, so negative, yeah, negative, not favorable, not good reaction, right? So, well, like not good reaction, negative reaction to painkillers. Okay, another question. Could you roll up your sleeve? Now, is it clear, and do we know why you would be asked to do something like that? Why would a doctor ask us to roll up our sleeve? What do you think? To see if we have a rash, okay. He wants to fight, okay. Yeah, well, measure your blood pressure, thank you. Okay, examine your blood. Very good answers. Exactly. Okay, open your mouth widely and say, oh, right? We're often asked to do that so the doctor can check if well, your throat is red, if there is some inflammation. Or we need to take a urine or blood sample, right, to examine it or have it examined. Or they might say, I want you to see a specialist, which often happens. Now, speaking of specialists, okay, short digression now. So what about a GP? What kind of, well, that's not actually a specialist, but do you know whom a GP is? What kind of doctor is it? Or in other words, a general practitioner. Oh, perfect. Very good answers. Yes, it's your, you say a family doctor, yeah. So a doctor trained in general medicine and treating people in some particular area. Oh, what a translation here from Thomas. Okay. Now, what about this one? Oh, terrible pronunciation here. Ophthalmologist. Ophthalmologist. Oh, so it's really tricky. Or simply an eye specialist or doctor. The picture is supposed to help you, but maybe you'd like to use the question box to say whom is meant here. Eye doctor, eye doctor, eye specialist. So here she would check your eyes here. Yeah, I see, I know it very well. Okay. So for your eyes, Now, what about orthopedist? So that kind of doctor you'd visit if you had a problem with your bones or your muscles. Bone doctor, that's right. Yeah. Another one, gynecologist. That's obviously just for women. And last but not least, we have a laryngologist. So ear, nose, and throat specialist. It's very similar to Polish, so I'm sure it's clear. Okay. But obviously these are just some of the most common specialists, so obviously you can have some other ones as well. So let's practice, okay? Let's practice some questions a doctor might ask you. Any, could you match 1, 2, 3, 4 with A, B, C, D? Any, what do you think? Number 1, how would you match 1? Okay, I'm waiting for more answers from you. Perfect. Any diarrhea? That's right. Number 2. Any pain? Okay, good answers. Any pain when I press here? Bravo. 3. Any symptoms? Okay, great answers. Any symptoms apart from the cough? And anything else, obviously, before you go? Okay, another exercise. So a doctor talking to a patient replying. So again, let's match these. Your throat is very sore, but it doesn't look infected. How would you match this one? Number 1. Obviously, is there anything that'll make it easier to swallow? Do we know the word swallow? Yeah, like when you drink or eat, exactly. It kind of hurts when you have a sore throat. Okay, and number 2, you've got very high blood pressure. Well, obviously, I've been under a lot of stress recently with a patient reply. More. But now, okay, so let me show you the correct answers. More, but this time a patient sort of addresses the doctor replies. So I've had this nasty cough for weeks. And what would the doctor say to that? Have a look at ABC. Now what do you think? Oh, okay, good answers. Yep. So it's a chest infection. It should clear up with antibiotics. So it should help. 2, I've had a high temperature and an upset stomach. What about this one? Good answers. Yeah, there's some virus going around. I just rest and drink lots of fluids. And I've developed this rash, if you remember, the red spots on my skin. It's all red. So obviously it could be a reaction to an insect bite, right? Being bitten by an insect. So I'll give you some cream for it. Now, what are some doctor's suggestions, some doctor's advice, and how can we expect him or her to formulate such suggestions? Let me show you. So the doctor might say you need to, for example, stay in bed for a few days, or you really should see a specialist, or you'd better, for example, what? You'd better, I don't know, drink a lot of fluids, right? Or just, again, stay at home for a few days. Why don't you have a checkup or an x-ray, for instance, which we're going to talk about soon? Okay, so I don't think this is something actually new for you, so let's perhaps practice again and match 1, 2, 3 with ABC. I've got sunburn. So you spend too much time in the sun. My nose is really red. What would the doctor suggest here? Yeah, you'd better put some cream on it immediately. So that's B. I think I've got a broken thumb. Well, okay. Well, actually, it's you need an X-ray, right? It is an A. And 3, I got a cramp when I was swimming. What's a cramp? Do you know this one? What's cramp? Yeah, very good answer. It's the severe pain you get in your in a part of your body, which is a muscle becomes sort of too tight. Yes, it's difficult to move it, to move the body part. Yes. So what does the doctor suggest? You're probably dehydrated, which means so you should drink more water. I suppose it's kind of obvious, but well, you don't have enough water. Yes, in your organism, you're dehydrated. More suggestions. I've got a black eye, as you can see in the picture. What would the doctor suggest? Yeah, perfect. You'd better put a bag of ice on it. Now my feet are killing me. I've got terrible blisters. Do you know the word blisters? So that's like sometimes when you put new shoes on, they give you blisters. Perfect, of course. See, it is, so you better put some plasters on them. And my big toe is painful, looks funny, and I can hardly walk. Well, obviously, you really should consult a doctor. All right. So, well, obviously, the doctor might also suggest that you take some medicines, all right, some other course of action. So the doctor might actually prescribe some, well, for example, some antibiotics to you. Okay, so can you help me? So the doctor prescribes or writes what? What's this kind of, well, a paper note that he writes? What's the word for this kind of paper? Oh, right, I see now the word oh, right, so not everybody is right here, but yes, so he gives a prescription actually. A prescription, so that's only for the drugs which are sold on prescription or by prescription in American English. So you need this kind of written order from the doctor to be sold these drugs. Well, or not, right? You can simply buy some medicine over the counter, so you do not need a prescription. So they're the less serious ones. Right, but you see, I've just noticed here, and actually some of my students also have a problem with this word prescription, because sometimes it's misused, and sometimes my students use this word to mean preppies, so the picture in the middle of the slide. So would we actually revise these words here that you can see here in these pictures? So on the left we see obviously just talked about it. This one is a prescription, obviously. And in the middle, what's this in the middle now? What do you call this? So instructions for cooking, preparing a dish. Okay. So this one is a recipe, and the last one, the kind of piece of paper you get saying that you've paid for something. And careful with the spelling here. Bill, all right, but it could be a receipt, which well, is kind of similar to recipe, so it's often a problem, right? So let's perhaps practice quickly. I cannot remember how long I should cook it for. I need to find the, what's this? Yeah, of course, the recipe, thank you. Sorry, you need to buy this medicine, so you need a Monica, good answer, Thomas. And Elżbieta, of course, you need a prescription. So, last but not least, here's your change and a receipt. Yes, careful with the spelling. It's kind of tricky, right? Especially the difference between receipt and a recipe. Okay, so well done. I see you've remembered everything correctly. So let's move on now to, well, rather unpleasant thing, part of the webinar, that's accidents and injuries. So if you study the picture here, what do you think's happened? What's the problem? What's the problem here? Any suggestions? Any ideas? What problem will the girl have now? I see some good answers. Right. So we could say she's twisted her ankle or maybe sprained her ankle. Right. So very similar expressions. Also, what might happen is you might strain or pull a muscle. Do we know this one? To strain or pull a muscle. So it's like you injure your muscle or body part by using it too much, simply working too hard. Okay, Thomas, it's a good answer here. So you strain a muscle, you've been using it too much simply and it hurts. Okay? Okay, so let's go on. What about this one? What does this picture show? Do you know? Bruise, thank you. Of course, a bruise it is, or you can bruise a part of the body, so it could be used as a verb as well. I don't have a picture for the next one, but you can obviously cut a part of your body or injure or wound. Again, synonymous expressions. So injure would be to hurt yourself in an accident, some attack. Wound would be to injure somebody with a knife or a gun. Okay, and of course we can say a wound or an injury, which you can see in the heading here. Okay, what problem do we see here? So the person's touched something hot, burning hot, and obviously they've burnt themselves. Obviously, you can also get sunburn if you've spent too much time in the sun. And what about this picture? Please notice how the hands differ. What problem do we have in here? So this hand on the right is kind of larger, rounder than normal, or than normally. What problem do we have here? Do you know? No, it's not a rash. It's not a rash. The rash would be, you know, the red spots on your skin. Okay, let me help you with this one. So this this hand is swollen. Okay, it's swelled or it's swelled up, and it's swollen. Okay. Right, and even more accidents and injuries. What about this picture? What does it show? Broken leg, precisely. There's another medical term you can use, fracture. So it could be used as a verb or as a noun. So to fracture a body part or a fracture. Okay. And what about this picture? What do you think? So we see an insect here, like a say a bee or a wasp, and you've been stung by a bee, a wasp, or you might be bitten like by a dog. By the way, do you remember the third forms, or the third and past simple form of the verb bitten? You have the past participle here, bitten. What are the three forms of the verb? Thank you, Grzegorz. We have the first one, which is a bite. What about past simple form of it? Oh, well, okay. Some of them are correct, some of them are not. Bite, bit, bitten. So a bit tricky. Irregular verbs, huh? Sometimes they cause problems. Okay, so I see some grammar experts here. All right, so let's see how much you've remembered. I broke or my leg during a football training. Oh, righty, of course, I fractured my leg. Number 2, a bee stung me on the arm, and it is kind of big now. What happened? Yeah, just careful with the spelling. okay, the swallow would be, you know, like when you're eating something, right? But here it swelled up. Swelling is to become big. Yeah. I was cycling and a car drove in front of me. I crashed into the side, and what happened to my wrist? Do you remember? What can happen to your wrist? So yeah, of course, you can twist it or you can sprain it, right? You sprained your wrist. And last but not least, I spent the whole day on the beach and ended up with terrible, perfect, yep. So it could be right. Instead of burn, you can say sunburn because it's about the sun here. Okay, and just yeah, just a few more. I didn't really warm up before we started playing or some kind of training, and so what happened to my muscle? Do you remember? What can happen to your muscle? You strained it, yes, or you pulled your muscle. Next one, I got a really bad knee. Here we need a noun. A few years ago, and it never really recovered properly. What would that one be? A bad knee. You hurt yourself. Yep. Thank you, Monica. And an injury. 7, I was walking down the street and a dog suddenly attacked me and yeah, careful with grammar here. So bite is the first form. The dog bit me. Okay. So now if the accident or an injury is very serious and you might have to go to hospital, what kind of treatment would you receive in hospital? Okay, so you'll obviously first be examined or you'll have a checkup. Well, if it's a case of a fracture of a broken bone, you might be sent to an X-ray. If you remember, we've already had this one before. If there are some heart problems, you might have an electrocardiogram performed, which is similar to Polish, obviously. And for instance, when your blood pressure drops too low, you might be put on the picture shows, do you know what this one is? You might be put on oh, maybe that's not the easiest one. You might be put on a drip. Okay, so that's when the liquids or medicine go straight into your blood. And if you've now received some injury or a wound, it'll obviously be, oh, you of course you also receive injections, right? Or you might have to receive some injections, which I'm sure you know. And if your injury or wound is really serious, it'll have to be cleansed. Careful with the pronunciation. What do you think will happen to it? To cleanse is to, what do you think? Right, you don't really know, so to make it completely clean, right? So cleanse or sanitize. Sanitize, okay, so again, to clean it thoroughly, remove dirt and bacteria from it. What about this picture? What do you think it shows? So if a wound requires it, it might be kind of sewn, right? Okay, yep, sewn, just Grzegorz, I see, knows it, Monica knows it. So you need stitches, okay, or it'll have to be stitched up. So it's kind of sewn, right, just like you sew clothes. And then again, after they've done it, it might have to be dressed, or a dressing will be put on it to cover it and protect it, obviously, surely by a nurse. What other treatment might you expect? Well, the first one is here is plaster. So as you can see here in the picture, the girl's leg is being put in plaster. And what is she using to walk? What helps her walk? Do you know this one? The long sticks that you put under your arms and they help you walk when you have a problem with your leg. Okay, just I see Yannick knows it. It's just that the spelling's a bit different. Crutches, right? So you use crutches. And what about this? What about sling? So sling would be this piece of cloth that you tie around your neck to support an injured arm or hand. Okay. So lots and lots of new vocabulary, although not for everyone, because I could see some of you were actually familiar with all these words, but still let's practice now. So I'm afraid we'll have to put your foot in for a few weeks after the surgery. Very good answer, of course, in plaster. The cut was so serious it needed 10, what was the word? 10 what? Perfect answers. Just careful with the spelling again. Okay, so stitches. And abdomen control will include a physical check and questions about the problem. The word check is there. Not sure if you remember. It was kind of at the beginning of hospital treatment. Okay, maybe I'll help you with this one. So check up simply check up. Right, so they physically check it and ask you some questions about your problem. Last but not least, the nurse came and put what on my wound? So for protection, so that it wouldn't get dirty. Yeah, she dressed it, yeah, or put dressing on it, right? Dressing used as a noun. Okay, and more exercises. What about these pictures now? What about this picture? First one on the left, what does it show? See some good answers. Injection it is, or it represents an injection. What about the one in the middle? The kind of cloth tied around your neck. It's a sling, thank you. On the right we see, what do we see? So it's like liquids go to your blood directly through it. Yeah, careful with spelling, so it's a drip, right? On the left at the bottom we see, well, could be different things in here. What I meant here are crutches. Sorry, so I should have perhaps used an arrow. Crutches, and last but not least, we talked about this one a few slides back. Yeah, it's about blood pressure. What do you do with blood pressure? What verb do you use with blood pressure? You measure blood pressure, check blood pressure, or you take blood pressure, right? Okay, and more, just 2 more slides of practice. So again, let's match 1 to 3 with ABC. They've broken your collarbone, I'm afraid, the doctor says. What does the patient say to it? I see lots of B answers, which is the correct answer. Oh no, how long will it take to mend? By the way, what is mend? I can see Grzegorz needs to run. Okay, so what does it mean to mend? Do we know this one? To adjust, okay, maybe to become healthy again, right? To be sort of good again. Yeah, kind of repair. 2, it's quite a nasty cut. Oh, it'll take a while to heal. Okay, so good answers again, of course. So will it need any stitches? Heal? What about heal? It'll take a while to heal. Okay, to become, yeah, healthy again. And last one, we can give you an injection for the pain or get any medication. Obviously, I take something for heart condition and a dust allergy. And really the last one, my ankle is swollen and it really hurts. I can hardly walk on it. Boy, that's a problem. What would the doctor say to that? Yeah, I see some good answers. It's probably just sprained, but we'll give you some painkillers and do an x-ray to check. I'll write a note. And 2, I felt dizzy, fell and hit my head. That's a nasty bruise. Did you actually lose consciousness? What's that? Do you know this expression, to lose consciousness? Yeah, to kind of, yes, go into faint. Yes, go into deep sleep. All right, I see some people had to actually leave us and go, and we're actually finishing because that's so much about all the unpleasant accidents and hospital treatment, which in fact I hope you'll never have to receive. And now let's do something that's a bit more fun. Because what I'd like you to do now is take a quiz to see how old your body is. But in order to do that, you need to have some, well, a sheet of paper and something to write with. Let's do it very quickly. Okay, that's, hope it's going to be fun for you as it was for me. So tell me if you're ready. Have you got anything to write with? Are you ready? Can we start? Yes, you are ready. So let's start with exercise, okay? How much do you walk a day? Is it A, a lot, B, not too much, or C, very little? Can you please write 1, A, B, or C on a sheet of paper? And be honest, but don't tell me, okay? Just say it on a piece of paper, and then you'll see what the results will be. In the end, how much sport and exercise do you do a week? Is it a lot, a little, or none? So give some sincere answers. Be honest with yourself. Put the answers on your sheet. Okay. Let's go on then and talk about your diet. How much fast food do you eat? So would you say I eat too much, I eat quite a lot, or I don't eat much, or maybe I don't eat any? So don't tell me, just put the answers down on your sheet, okay? How many portions of fruit and vegetables do you eat per day? Is it only a few, quite a lot, or a lot in C? Please put down the answers on your sheet, very important. Okay, now, what's your worst diet habit? You eat too much fat, too many sweets, you drink or eat too much, or maybe none of these. Which one is it? But don't tell me, please don't tell me. Just use, you know, your answer sheet, your notes, to piece of paper to write down the answers. Lifestyle. How many cigarettes do you smoke a day? Is it none, a few, or a lot? So be honest with yourself. 8. How would you describe yourself mentally? So not physically now, but mentally. I'm a very positive person. I'm not positive enough. I'm rather, and see, I'm quite pessimistic. Which one is it? You don't have to tell me. Okay. And just 2 more questions. How would you describe your stress level? I'm too stressed. I'm stressed, but it's under control. I'm quite relaxed. And really, the last one, how often do you wear sunscreen? Oh, sorry, it's not actually the last one. How often do you wear sunscreen? All year, only when I'm on holiday, or when it's sunny? Choose the right answer. Okay, so see Eva's still with me. Okay. And just a few more about social life. How many close friends do you see regularly? Is it a lot, quite a lot, a few, or not many? None. Be honest, sincere with yourself. And last but not least, how much time do you have for yourself? Is it none, not enough, or maybe quite a lot? Okay, so I hope you've put down all the answers on the sheet of paper, because what I'd like you to do right now is, well, work out your body age. So analyze the results, what you've put on your piece of paper, and try to add all these numbers or subtract. Tell me if you're ready, and I can go to the next slide to show you 7, 8, and up to 12. Okay. Okay, so most people are saying they are ready. Yeah, shall I? Don't worry, I'll send it to you later on, but let's go on to the next slide, the last one. So analyze your answers, and I'm waiting for your answers, but I just want you to tell me if you're happy with the result or if you're not. Is your body younger or older actually than your age? Were you happy with the result? Very happy. Okay, great, Vito. Good for you. So I suppose your body is kind of younger than older. Some people say older. Oh dear. So there's room for improvement, right? You know what to do probably. Okay. 12 years younger. Oh dear. Congratulations. Perfect. Okay, so I hope you've had fun. And don't worry, we will send you all the materials obviously after the webinar. Any questions now? So think about your questions, and in the meantime, over to you, Tomek.